This is Living Today, Martha Stewart, Living Radio. And again, it's our special start time of 2 p.m. Eastern. Also on the show today, right now, Dr. Monica Halem is here, dermatologist at Columbia University Medical Center East Side. Dr. Halem, how are you?
Hi, how are you?
It's great to see you. Thanks for being here on Living Today.
Thanks for having me.
You know, and we're here visiting with you for a very special reason, not just the fact that it's winter time and our skin, you know, is getting the onslaught of the elements, but it's sort of a New Year's refresher course on skin care. Is it sometimes at the bottom of our health checklist, our skin?
I think you're right, Mario. This is something that we kind of put on the back burner, and really, you know, that's really the foundation of our health and our glow and what we appeal to the you know, when we meet people. So I think it's really important skincare, and as you know, no good makeup is really good without a good set of skin to start working on. So skincare is very important. So some of the things that I like to encourage is a routine. It's very important for people to keep repetitive at what they do.
And it is an inclusive routine, gentlemen. We're talking ladies and gentlemen as well.
Ladies and gentlemen, especially gentlemen. Gentlemen often forget.
Are though guys such as Chris and myself, are we now cluing in more and more to the fact that we need to take care of our skin?
I think that's completely the case.
Mm-hmm.
Guys are much more aware now that it's important to keep their skin looking fresh, and as well as protecting from having sun protection.
Dr. Halem, before we begin our skin care regime, do we need to first figure out what kind of skin we have?
Well, it's important to know there's different color skin as there is different skin type.
Mm-hmm.
And depending on what skin type you are, as well as how sensitive you are to certain products, that'll gear your repertoire.
Okay, let's go around the room. I have sort of that toasty brown cinnamon, you know, can be very dark brown in the summertime. Chris is very fair skinned, as is Naomi. So we would have different skin regimes.
You would. So you, with a darker skin type, you're less sensitive to the sun than would be Chris or Naomi, just due to the melanin that you have in your skin that'll protect you from the sun. But it's still important that somebody as yourself use sunscreen every day. And that's the biggest thing people forget, whether you're light skinned like Chris or Naomi or dark skinned like yourself, you want to make sure that you wear sunscreen at least SPF 30 or higher.
At least SPF 30.
At least SPF 30. And the people forget that even in the winter or even on a cloudy day, you are getting sun. Sun comes through the windows or when we're walking from our car to the house or just daily routine.
So our skin needs sunglasses.
Your skin needs sunglasses. That's perfect.
Thank you. To ask Dr. Halem any skincare question that you want. Dr. Halem, right, you can answer A to Z.
I can answer A to Z.
Here we go. 866-675-6675. You want to ask about a skin cream, an unguent that you are using, a regime or not. You know, here's your chance to ask your questions. Any worries you have about any appearances on your skin that could worry you, a bump, a rash. 866-675-6675. We've all been through that when we're told to check our skin for anomalies. Do we do that often enough, you think?
I don't think we do, actually. And what I usually recommend to my patients is they do it at least once a month. And some of the things you want to look for, and we call it the A, B, C, D, E's of melanoma. And A stands for asymmetry. For example, if you are looking at your skin and you see a brown spot or a spot you're concerned about and you cut it in half and you look to see if one half is the same as the other side. And that's sort of A. You want to make sure that they're symmetrical. Okay. That's our A. Our B is for border. So you want to look at the border of the area that you're looking at to make sure that it's regular. If it's irregular, then you might want to be concerned and maybe go see your dermatologist.
Okay.
Our C is for color. Things such as dark, very dark, black, red. Those are some things you want to look for.
I'm looking right now.
I can see that.
I don't have any here on my arms. I have that one little red dot right there.
That's fine. Those little red dots that we have, those are called cherry angiomas, and those are completely normal. Those come as we get older.
Well, I'm 53, so that counts.
All right.
Please call that a beauty mark.
That's a beauty
mark.
mark.
Thank you so much, Dr. Halem. Questions for the skin doctor? Dr. Monica Halem is dermatologist at Columbia University Medical Center East Side, and I understand there at Columbia University Med Center East Side, you really stay on the cutting edge of skincare and the knowledge of the latest research and statistics on our skin.
We do, and especially we do a ton of research at Columbia ourselves. And it's important for me to sort of educate myself so that I can educate the people around me.
What's one of the most recent things, perhaps, that you have learned about that has even surprised the doctor or that has amazed you, or something new you have learned about skincare due to recent research and statistics?
I've learned that a lot of the skincare that's out there is a lot of hype. And you want to really be careful about what you buy.
For example,
most of the products that we have out there are claims that aren't held to scientific standards. So any company out there can sort of say it's the latest, newest, greatest.
Look younger,
wrinkles gone, and they can write these claims without any scientific proof behind that. So the one thing that I've seen amongst all my research and literature reviews is that the one thing that we can put our hat on is something called a retinoid or retin-A. And so according to me, there's two things every woman or man needs in their skincare regimen, and that is a sunscreen and a retinoid at night.
Everybody?
Everybody.
Where do we go get retinoids?
Well, you can start with an over-the-counter product that has retinol in it. There's a company by the name of ROC, R-O-C, which has a very light retinol in it.
And what does it do for us?
So what a retinoid does, and it's, like I said, it's the only one that's been scientifically shown to do anything, is it normalizes the skin surface. So it does that. It increases collagen production, so it gets rid of a lot of those fine lines and wrinkles. In addition,
R-O-C,
well, that's the over-the-counter product. And then if you're interested in going to a more prescription strength, your dermatologist can get that for you. But I would recommend starting with the over-the-counter product. And the way you want to start is a lot of times what happens is people use a retinol and they get very red and irritated, and then they say, I'm sensitive to it, I can't use it. And I usually find that people aren't using it correctly. So what I recommend is you start with an over-the-counter product and you use it every third night.
On your face, on your hands?
On your face, on your hands. And you only use a little bit. So you have to remember, it's a medicine. It's not a cream. So you only use a little bit around and you rub it in every third night for a couple weeks, then move to every other night for a couple weeks, and then move to every
Let your skin get used to it.
You got it.
Okay.
Exactly.
Dr. Monica Halem is here answering your questions. Sue in St. Louis, Missouri. Thanks for being here on Living Today, and you're on with Dr. Halem. What's your question, Sue?
Hi. My question is concerning some type of cream to put around the eyes. I have a dry eye problem, and the drops that I use for that seem to irritate the skin around my eyes. And the ones that I've tried, several over-the-counter products, if I get the least little bit, like even on my finger or something, and it gets in my eye, it burns. So I was just wondering if you had any suggestions regarding an eye cream that would be safe to use.
Any of the eye creams out there I think are safe. Now, are these the drops that you're putting in that are irritating the skin?
Well, I put the drops in, but it seems like, even though I dab as the drops, come out a little bit, there still seems to be some that gets on the skin.
Okay. What I would recommend is especially when you put the drops in, maybe putting a tissue paper on the lower eyelid margin, and just so that it catches anything extra that's coming out. That's one thing. The other thing you can do is try a little hydrocortisone 1% cream, which is an over-the-counter cream. And you can actually put that in the area that's irritated. As far as any cream for anti-aging or just moisture around the eye, pretty much anything over the counter is fine. A couple products that I like, Cetaphil, Olay, all of them make an eye cream that's very moisture rich. The other thing you want to remember, like we talked about earlier, is you want to find something that has a sunscreen in it as well.
Okay. Now the Cetaphil eye cream how does that come? Because I use Cetaphil as far as my moisturizer because I do have sensitive skin. And how does the eye cream come?
It comes in a little tube, but you can use, like I said, if they don't have it in your pharmacy, that's fine. You can use any of the eye creams that's out there. I happen to really like the Olay Regenerous brand as well.
Oh, okay.
Thank you, Sue.
Very good. Thank you.
Thanks for your call and great questions. 866-675-6675. Dr. Say hello to Kathy in Colorado.
Hi, Kathy.
Hi. I live at 7,000 feet, so we're very high altitude, and so it's very easy to have your skin dry out. And I was just going to ask you about Olay Regenerous. I don't know how to pronounce it exactly, but that's exactly what I use. Would you suggest there's anything else that I could add for wrinkles?
Well, somebody like you that's at 7,000 feet, you have a few things to worry about. One is the dry air, like you had mentioned. The other thing, again, I'm gonna push sunscreen because I'm a big proponent of sunscreen. But you especially need to make sure you have sunscreen on. So for you, what I would do is I would use a heavier cream formulation, especially in the winter, as opposed to a lotion formulation. So the cream has more of an oil to water base. So you want to use a facial cream that has sunscreen, and then on top of that, I would put a sunscreen. SPF 30 or higher. Again, the Olay, Cetaphil, Aveeno, they all make great products. I would go to the drugstore, try a few, and see how it feels on you, and you can go from there.
Can I ask one other question?
Certainly.
Is Noxzema still used for people to cleanse their skin? Like, I do that daily, and I don't know if that's not working for me or if it...
So that's a good cleanser. The other one I like that's great is Cetaphil. It's nice and gentle. You don't want anything harsh on your skin. You don't want to use a scrub or anything like that. So anything soft, gentle, more of a milky as opposed to a foamy cleanser is what I like better.
Okay.
Thank you, Kathy.
Bye-bye.
Thank you very much for calling. This is Living Today, Martha Stewart, Living Radio, Sirius 112 XM 157. We're visiting with dermatologists at Columbia University Medical Center East Side, Dr. Halem. Dr. Halem, thank you for being here.
Oh, you're welcome. My pleasure.
It's how we visit with some more Living Today
Sure.
listeners. Okay, here's Chris in Florida. Hi, Chris. Go right ahead.
Hi.
Hi, Chris.
Hi. I have a question about precancerous spots. I've always heard the traditional description that you just gave a few minutes ago, and I went in for a checkup, just a checkup with my dermatologist, and she froze several spots, couple on my face, that she said were precancerous. I had no idea because they were like white and dry skin patches is what I thought they were. And so I guess I'm asking, can it look differently?
It can. So the ABCDEs that we talked about earlier, that's more for a melanoma. So there's three types of skin cancer that are your basic types of skin cancer. There's a basal cell carcinoma, a squamous cell carcinoma, and then a melanoma. So melanoma is more the ABCDEs. The basal cell and the squamous cell, which are sun-induced, almost 100% sun-induced, those have sort of a rough pink, sort of like a scaly, feels like a little bit of dry skin, and they usually occur on the cheeks, top of the nose, the ear, the scalp, and the chest, and the arms and hands. So those are some of the things you want to look for, that rough skin that sort of doesn't really heal and can sometimes
It never goes away.
It never goes away.
Right. This would seem to, and then it would be back again.
Right. That's usually a good sign.
All right, Chris, thank you for your call.
Thank you.
Take care. Doctor, there at Columbia University Medical Center Eastside, you get a lot of calls of people, legitimate worries about there's something on my skin and I don't know quite what it is.
Yes, all the time. And it's always better to, if you have any question at all, to check with your dermatologist.
Is there a checklist or a timeline, for example? It's happened to me, too. I'll I'll wait 2 days to see if it goes away. I'll wait 3 days. And what's the general rule for that?
I think about a month is usually good. If it doesn't go away within a month, or some of the other signs, if it continues to bleed, or if it heals and then comes back and doesn't really go away and just really looks different, that's usually something that you want to check out.
Say hello to Beverly in Ohio, Doctor. She'd like to visit with you as well.
Hi, Beverly.
Hi. Thank you for taking my call. I am 62, and I have a lot of red on my neck. I don't know if it's age or from being in the sun, but it never goes away. Now, I have very sensitive skin. I have eczema, and I have psoriasis. Could that be related?
It could be related. Actually, a lot of times when you have redness on your neck area, it's usually due from too much photo damage. So that's probably what you're seeing on your neck. And we don't really think to put sunscreen on our neck because we think it's out of the sun, but that's another place. Your neck and chest are really important to apply sunscreen.
Okay, thank you.
Thank you very much for your call. Michelle in Pennsylvania, you're on Living Today. Martha Stewart, Living Radio, and the doctor will see you now. Go right ahead.
Well, thank you for taking my call as well.
You're welcome.
I am in my mid-30s, and I'm fortunate that a lot of people think that I'm younger than I am. I use all the appropriate moisturizers and wrinkle creams and all that. But what I'm starting to see with myself is that I have a little bit of sagging underneath my chin. So I know there's a bunch of solutions and magazines and all that out there. So I was just curious to find if there's anything that's proven to actually keep that firm, or what I could do going forward so it doesn't continue to get worse. I know it eventually will, but anything to slow it down, I'll take some advice on.
Right. Well, first of all, I commend you for starting on your skincare early. That's great. Prevention is the key to everything. So as far as the sagging skin on your neck, you can try the retinol that we talked about earlier, because sometimes that increases the collagen production, and that can help tighten it a little bit. But for that, you really need more of a surgical approach, but later on.
Okay.
Thank you, Michelle.
Yeah.
The thoughts, too, on, we do some Pilates, we do some stretching, we do some yoga. Are those non-invasive techniques beneficial to those of us who want to preserve the what do you call it, the elasticity or the strength of our skin?
I think that the exercise itself is good for your overall skin tone, your overall skin color. I'm not sure if the exercise itself will do anything to prevent wrinkles or anything like that, but I think just an overall low stress level, which Pilates and yoga can help us with, that can sort of stop the aging process.
Doctor, how should we wash our faces? I know it's such a basic elemental question, but I have a little face brush and I have my little scrub brush. I use it now and then. Is it okay now and then to do?
It's okay now and then. Too much scrubbing is not good for the skin. So your skin wants to be treated gentle. If you're gentle to your skin, it'll be gentle to you back. So what I like to do is, again, repetition is key. You wash your face twice a day, something very gentle like a Cetaphil wash or a Olay milky cleanser. That's what I really like. And then maybe once a month, maybe give it a little bit of a scrub. But the retinol, that if you do use that will help to sort of get rid of those dead cells.
And this is Lisa in Virginia. Doctor, say hello to Lisa.
Hi, Lisa.
Thanks for being part of Living Today.
Hi, thank you for taking my call.
You're welcome.
My question is, ever since I was a little girl, I'm in my mid-30s, I've had a small mole on my chin, under my lip. I mean, it's always been there, but over time, on occasion, it seems to fall off and bleed, and then it heals and the mole is back. Is that something I should be concerned about?
Well, if you've had it since you were younger, that's a good sign. If it hasn't grown in size or hasn't really changed that much, that's a good sign. Sometimes they do fall off and bleed a little bit, but if you have any question, I would really recommend that you see a dermatologist, and that way they can really take a look at it.
Okay, great. Thank you.
Thank you very much for your call. In terms of budget, doctor, what are some of the best items that you'd say are really good for non-invasive procedures?
Some of the over-the-counter creams, again, like we talked about, and again, repetition is important, just having a good routine. You don't have to spend a lot of money. You don't have to go to the department store and spend thousands of dollars on good skincare. It's really all about the basics. A good sunscreen, a good moisturizer, and a good Retin-A.
And some good nutrition, too, I would imagine.
Good nutrition goes a long way. Good nutrition, water. What happens is when you drink water, the cells in your skin and everywhere else actually absorb that water and become fuller and plumper and really give a nice plumpness to the skin.
No short shrift on the H2O.
Right.
Mike in Tennessee, this is Living Today, and you're on the air with Dr. Monica Halem. What's your question?
Yes, sir. I had melanoma and metastasized into my lymph nodes in 1998, and I had a radical neck dissection, and they gave me treatments of interferon that removed all of the pigment out of my skin and out of my hair. And I don't have any moles on my body, but I have a place on my cheek that's it kind of burns and itches a little bit occasionally, but it doesn't have any of the characteristics that you described. But anyway, I'm wondering, I got this in my truck, what should I be putting on my face with zero pigment in it?
Well, especially somebody like you that has no pigment. The pigment actually protects us from the ultraviolet radiation, which is why somebody who's darker skinned is actually a little bit more protected, even though they can get skin cancer. So you especially, since you've had this treatment and have a history of melanoma, with a neck dissection, you need to be wearing as much sunscreen as you can. So not only do you need to put it on once a day, but you need to keep reapplying it, especially in the summer when you start sweating and it continues to come off. In addition, you especially need to see a dermatologist at least every year and make sure you get a good checkup, and especially that area where you had the melanoma originally.
Okay, but that spot that's like itching kind of on my face, I feel like when the sun hits, it's like a burning deep down inside, or like a cooking sensation like?
Right. Well, I would recommend that you go have that checked out for sure. The other thing you can do is you can go online and find what we call sun protective clothing, and it's actually clothing out there that has ultraviolet in it. And when you're driving in the truck, maybe wear a broad rim hat, some sunglasses, and make sure you wear long sleeves.
Okay, well, I do the long sleeve thing. Okay, well, thank you very much for your time.
No problem.
Thank you, Mike. Happy driving and great questions. Thank you so much for calling us here at Martha Stewart Living Radio, Sirius 112 XM 157. This is Living Today, and I'm Mario Boscas. I want to thank Dr. Halem again for being here, because it really eases a lot of our worries and a lot of stress, and we do have an unanswered question, sort of a blank spot in our skincare regime. Suzanne in Texas has a question for you as well. Hi, Suzanne. You're on the air.
Hi, it's so good to talk to you, and I thank you for taking my call.
You're welcome.
I have a little bit of a problem in that I have very thin blonde hair. I do live in Texas where there's plenty of sunshine, and my head burns on a regular basis. I can't always keep a cap on or anything of that sort. Is there anything else I can do?
Well, you run into this problem, and men who are going bald also run into this problem. And it's interesting because we do see a lot of skin cancer on the top of the scalp. So what I would recommend to you is that you try to wear a hat as often as you can, especially one that has ultraviolet protection in it. And again, you can order that. There's many companies online that actually offer that. And you can put sunscreen on your scalp, sort of try to get it in there between the hair. But, you really have to be careful with your scalp area.
Is it more tender than other areas? I have had a couple growths removed because I grew up on the beach, and it was. I'm not there now, but my skin has been exposed to a lot of sun, and so now that my hair is so thin and blonde and not always blonde, maybe gray, but nevertheless, you're just suggesting that a cap is the only thing that would work, huh?
That's pretty much the only thing. The other thing you can do is limit the amount of time that you are outdoors in the sun, let's say. For example, you want to go out before 10 o'clock in the morning or after 4 o'clock at night. And always try to seek shade if you are outside. So more protection.
Doctor, also any sort of conditioners or emollients or anything that you can put into your scalp, or hair conditioners that may be friendlier to your skin that's so sensitive, such as Suzanne?
You can get some that say for sensitive skin, but nothing that's going to sort of give you that ultraviolet protection. They have not come out with sun or shampoo or conditioner that'll really protect scalp.
Which is not a bad idea.
Which is not a bad idea. They have it to protect your hair, but not to protect your scalp.
All right, Suzanne, thank you very much.
Thank you so much.
You're quite welcome, and thanks for your call. We touched upon this just a moment ago, Doctor, about youth and youthful-looking skin. What are some tips you can share with us, perhaps, if you don't mind, about ways, perhaps, that we can try to keep our skin to stay healthful and youthful-looking?
The best is good skincare regimen. Sun protection. It's really the number one cause of premature aging and wrinkling is sun. Just to be aware that it does come through the windows, and every time you walk outside, you get it. So really protect yourself. If you're pretty constant about that, you'll be fine. The other thing is, like we talked about, nutrition, having a stress-free life, trying to sort of minimize that kind of stress.
And also, you talked about the application of skincare products. Is there such a thing during the day, or is it depending on the season as reapplication?
I do. I actually often reapply my moisturizer, usually after lunch, especially under the eye area, which is a very delicate area. And you want to make sure that you use your fourth finger when you're doing it under the eye. So you want to take your fourth finger and sort of lightly dab your ring finger.
The ring finger I'm looking at. I know I have fingers. I'm trying to figure out which one it is. Use your ring.
Use your ring finger, because that's the most gentle finger. And anytime you sort of pull and push on your skin.
Use your ring finger, Chris.
Let's see you do it, Chris.
Too, right,
Come on. There you go. Perfect.
Doing it okay?
Perfect. So you put a little bit of ointment there, and then you put it on underneath your eye. So anytime you rub your eyes or you rub your skin, you're sort of breaking up the collagen and the elastic tissue. So you want to really keep from doing that on your skin.
So general rules, hands away from your face.
Hands away as much as you can.
And so many times we sit with our faces cupped in our hands and, make all these faces and do all that. It can cause some damage then.
Right, exactly, especially causing wrinkling.
I noticed there's a great website, aad.org.
AAD.org is a great website. There's the ASDS.net, that's the American Society of Dermatologic Surgery. Both of those are great websites to get information both on skincare, sun protection, and different
I signed up for the newsletters.
Great.
At AAD.org. I signed up, and they will send you like a monthly, weekly newsletter on the latest skincare. Also, Dr. Halem will be back here on Living Today. Wonderful guest, and thank you so much for being here.
Thank you very much for having me.
You're quite welcome. Dermatologist at Columbia University Medical Center East Side. Doctor, again, thanks for being here on Living Today.